I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today our topic is about UTI treatment. And we only focus on the treatment about antibiotics, about Western medicines. Right? We're not talking about acupuncture or Chinese medicines. We're talking about Western medicine. If you suffer from UTI, how would your doctor, your GP, suggest you the treatment? Now, if you're here, please give me a thumbs up and leave your name down there and let me know where you're from, who you are. And let me know, share with you if you suffer from UTI, what sort of treatment do you get, And if you're an acupuncturist, hey, let me know, do you have any case, have you had any experience to treat UTI? If you haven't got any experience, you're new in acupuncture or Chinese medicine, don't worry. Tomorrow, we're going to talk about acupuncture for UTI. We're going to talk about Chinese herbs for UTI. Okay. Now, I'm going to get to my page, which is Szenan-Balance Method Spirit G acupuncture page, and I'm going to share this live video, and I would like you to do the same, please. Right. I've got it in here. Hi, Veronica. How are you? Okay, I'm going to share as a watch party. Then the next thing I'm going to do is go to my Instagram and then put on my Instagram, personal Instagram, and do a live video. So if you're on Instagram for my clinic page, please share this live video as well. Thank you very much. Let's start. Okay, about, I'm not a Western doctor, but I have the knowledge. Where did I get my knowledge from? I went to Shanghai University of the Traditional Chinese Medicine University. And when I went there, we have 5 years course. 5 years for study Chinese medicines. Now, when I registered as a student in Shanghai before that, I knew that I had to study Chinese medicine and as well as Western medicine. Of course, full on. I've studied both. Now, if I was staying in China and practice in China, and I will be able to do Chinese medicine and Western medicines. And I'll be able to do a surgeon if I wanted to. Okay, so just take some more training. So which means we have all the course that the Western doctor required for to become a Western doctor. So I know the Western medicines, how they work. But by saying that, I'm not claiming that I have experience as a Western medicine in practice. No, I don't have it, which means I have the knowledge, I graduate, but I only practice in Chinese medicine and acupuncturist. So I want to let you know this. That's because it's a different law. When I came to New Zealand, which is as an acupuncturist, I can't do Western medicine. I only allowed to do acupuncture and Chinese medicine. There's different law in here. So New Zealand protected very well for Western medicine. Whoever you come from, you have to study in here. I've known a lot of Indian doctor, Western doctor, and they came here, they have to re-exam. You have to take the exam to pass the exam and become a Western doctor in a GP, and it takes so long. Okay, I have a friend as a Chinese doctor and acupuncturist from China, and he is now in his final year of an Otago University, finished his degree and become a GP. Okay, just letting you know that. But although by saying that, I'm going to let you know what UTI treatment involve in Western medicines. Okay, now I have an article in front of me. So the treatment of UTIs depends on the causes. Yes, what causes? It can depend on the we talk about the urine culture, right? It can be fungal, it can be virus. What else? Bacterial. Bacteria is the most common one. Okay, most common one. So your doctor, your GP, your MD, medical doctor, will be able to determine which organism is causing the infection from the test results used to confirm the diagnosis. Yes. How do you know that? From the urine culture. Okay. We talked about this yesterday, I think, a day before yesterday. Yeah, something like that. Hi, Eric. How are you? So it's Sunday, so hopefully everyone have a good Sunday. And Sunday for us, maybe for you is Saturday. Now, in most cases, the cause is bacterial, right? For UTI. So what do you treat for bacterial? We use antibiotics, most common thing. So everyone, just about everyone know it. Antibiotics is for bacteria. Now, remember, antibiotic is for bacteria, not for virus. Right. So in some cases, viruses or fungus are the causes. The viral UTI are treated with medication called antivirals. Often the antiviral is one of the antiviral. I'm not quite sure how to pronounce the name. It's called cidofovir. CIDOFOVIR. Is the choice to treat viral UTI. All right. And fungal UTIs are treated with medication called antifungal. A lot of people know about it. All right. So we mainly want to talk about the antibiotics because this is the most common one. So the form of antibiotics used to treat bacterial UTI usually depends on what part of the tract is involved. If it's in the lower tract UTI, it can usually be treated with oral antibiotics. So you just take it oral. Right? In the upper tract UTIs, require intravenous antibiotics. So it has to get an injection put into a vein. So it's different rather than oral antibiotics. So that is a different. So these antibiotics are put directly into your veins, all right? Directly into your veins. So sometimes bacteria develop resistance to antibiotics. What is the cause? Most cases in there is recurrent UTIs. Because recurrent UTIs, you get UTI again and again, and you take antibiotics and doesn't seem to be working. And as soon as you finish a little bit, not completely healed, and you get it again, the symptom comes again. So most of the time, it's because bacteria develop resistance to the antibiotics that you use. Does it make sense to you? So that is common. That is very common. So up to here, at this point, I want to share with you when especially antibiotics work very well. So don't take me wrong. I do agree with antibiotics. I do agree with it. But you need to understand one thing. When this happens, what is the best medicine for it? Chinese medicine and acupuncture. Yes, I do think acupuncture and Chinese medicine are better than antibiotics. Why is that? Because think about it. No one, we never found any cases that bacterial developed resistance to Chinese medicine or acupuncture. No, there's no cases like this, but common in antibiotics. And antibiotic has a lot of side effects. So what is the side effect? The first thing, it actually lower your immune system. It actually harm your stomach and spleen. According to Chinese medicine, the immune system, if you have a great immune system, you have a good stomach and spleen function. And once stomach and spleen function ruined, your immune system will get low and low and low, which means if you're taking antibiotics, there's so many people, I've seen a lot of patients, then once they take antibiotics, they get bloating, they go to toilet and lose bowel motion, and they get stomach pain. What does it mean? It actually indicates that antibiotics is ruining your digestion system, which is your stomach and spleen function. And you don't want that to happen. Not everyone will have the side effect, to be honest, but once you do have the side effect, you get the side effect, this is a red flag for you. And you need to understand, oh, this is not good. And you need to consider to change your treatment strategy rather than using antibiotics, Chinese medicine, and acupuncture. I would strongly suggest you to choose Chinese medicine and acupuncture. Okay, now let's keep going about this antibiotic thing. So the doctor will likely put you on a short treatment course possible. Treatment typically lasts no more than 1 week. So typically antibiotics, and if you are not taking it long time, like for a few weeks or a few months, and that normally fine. And normally when the doctor prescribes antibiotics, they only ask you to take about 7 days, no more than that. But if you still have the symptoms, and they might give you more, and that is a sign that you may have to think about, oh, do you need more? Do I need more? Ask the question, do I need more? If after 7 days the symptoms still there, it's up and down, ask the question for yourself, do I want to get resistance to antibiotics? If the question is no, think about using acupuncture and Chinese medicine. Okay. Result from your urine culture can help your doctor select an antibiotics treatment that will work best against the type of bacteria that's causing your infection. But I have to be honest to you, because the urine culture, it need to wait for time, for a few days. And normally when you have acute symptoms, you won't have the time to wait for that. Normally the doctor will just give you antibiotics straight away. So take it. They won't wait until the result came out. Okay, I will choose the proper one, the right one, the right antibiotics for you. There are many types of antibiotics. Okay, so I need to let you know this. But of course, in theory, You should wait for the urine culture to know what sort of bacteria, and then you choose the right antibiotics for yourself. And the doctor should do that, but no, in most cases, no, they won't do that. They'll give you antibiotics straight away, right? How do I know that? Because we treat a lot of UTI, so we know it. I asked him, have you done the urine culture? Yes, we've done it, but no, the doctor didn't wait for that. I just get antibiotics and I got better, or I just get antibiotic, but the symptoms still there because they didn't wait for the urine culture. You're using the wrong antibiotics. That's simple. So treatments other than antibiotics for bacterial UTIs are being examined. So at the same point, UTI treatment without antibiotic may be an option for bacterial UTIs, but using cell chemistry to change the interaction between the body and the bacteria. Yes, there are other treatments that you can do. So by changing the cell chemistry to change the interaction between the body and the bacteria, Chinese medicines, acupuncture, that can do that. Because we change the constitution of your body. But using Chinese medicine and acupuncture, yes, that is a great way. There's an alternative way to do that. But we've been using that for 1,000 years. So I want to let you know this. Right, stay awesome. And this is about the antibiotics for UTI. It's about UTI treatment in Western medicines. We're going to talk about Chinese medicine and acupuncture tomorrow. And of course, we're going to talk about prevention for UTI. Not tomorrow, the next day. And then we're going to talk about acupressure for UTI. It's something that you can do at home. So follow me if you keep following my live video, and you get a lot of tips. And I hope all this tip will actually help you. And of course, if you suffer from UTI, and my recommendation is go and get a local acupuncturist. Just acupuncture, I think it would be enough to help you. If you have recurrent one, which is a chronic problem, you need more acupuncturists, not just 1 or 2 times to get fixed. Okay, you need to build up your immune system. If your own immune system up, then you are strong, then your body will fight with any bacteria, any virus, any fungus itself. Right, stay awesome, and I'll see you tomorrow. Thank you very much.